Hi, I'm Mandy. I'll be performing an intramuscular injection following all GPSP guidelines. I gather all the equipment, I check the order, follow the 11 rights of medication administration, and perform the 3 med checks. I would knock on the door, enter the room, perform hand hygiene, put on my gloves, introduce myself to the patient. Hi, my name is Mandy. I'm your nurse today taking care of you. Can you tell me your name and date of birth?
James Griffith, September 30th, 2004.
Matches the armband. Do you have any allergies?
No.
I would complete all necessary assessments before administering the injection. My injection sites be the deltoid. I feel for the acromion process. Go 2 to 3 fingers down. Create my upside down triangle, and I would inject in the middle of the triangle. My next one is the vastus lateralis. I would create the tic-tac-toe board, okay, and I would inject in the outer middle third. And then for the ventral gluteus, you raise your arm for me.
Mm-hmm.
All right. I would place the heel of my palm, pop your hip, on the greater trochanter. My thumb is going to be pointing towards the groin. My index finger is going to be on the iliac spine. Move my middle finger dorsally to palpate the iliac crest. Then I would inject between my first finger and my middle finger right in the middle of the triangle. Thank you. Alright, I still have done my hand hygiene. I still have my gloves on. I'm going to get an alcohol pad in a firm circular motion when cleaned from the inside out. I'll let that air dry. I already have my medication already drawn up in my syringe. I'm going to use a 5/8 to a 1.5 inch needle. Okay. And I'm going to use my dominant hand. I'm going to go in at a 90-degree angle. Using my non-dominant hand, I'll stabilize the syringe. My dominant hand is pushing on the plunger, slowly administering the medication. I would remove the needle at the same degree that it went in. I would deploy the safety, dispose of it into the sharps container. I would apply a gauze or a band-aid. I would not massage the site. I would remove my gloves, perform hand hygiene, immediately document the medication that was administered. Then I come back and evaluate my patient's response to the medication.